Good morning, class. Today's topic, risk management and emergency policies. A lot of today's going to be covering things that we've already gone over in class up to this point. Arguably, we know that the number one most important priority of any fitness center or club operator is to ensure the safety of all of its staff and patrons, and that, again, preventing anything from happening harmful or injury otherwise to their members or their employees or guests or participants. So the reason why risk management and emergency policies is so important is that it covers everything in full detail that we've kind of gone over up to this point, again, in terms of CPR, first aid, AED, all the different kind of training that fitness professionals need to undergo as a basic requirement. And so we'll delve into it a little bit more specifically and kind of get into what does risk management mean. And basically, as we can tell, again, it's basically trying to ensure that it reduces any risk that happens within the gym. We've seen so many case scenarios and situational assignments that we've covered in class of potential problems that can happen, and will they happen? Most likely they will. And how does a entity itself basically have the opportunity to mitigate it or hopefully eliminate it and cut down any risks as much as possible. And there are different management and policy standards. So one of the items that we've already covered is that obviously there needs to be a written response, and this kind of goes into the department manual for the club. All of the department manuals need to have everything that we're going over, including all of these policies and standards. So as you can see, routinely there'll be safety audits that'll be gone through and covered, and they'll basically eliminate any hazards that could cause injury to anyone within the facility. And again, written systems for having all different types of handling of any of these hazard and issues in accordance, as you can see at the end here, with the Occupational Safety Health Administration of the United States, OSHA. So a lot of this, again, should be review and things that we've covered previously. Everything's going to comply within federal and state and local requirements. And as it pertains to AEDs, I know that a lot of us in class have already had this certification training. I encourage you as much as possible to uphold it and continue it every 2 years at least through any of the different types of accredited embodiments that kind of license these, and they're always available to provide AED, first aid, CPR. Again, this probably looks familiar, AEDs being in a 1.5 minute walk to any place that can potentially be needed. Skills reviews and practice sessions, practice drills. Best way to learn an AED is just to basically practice it and conduct it here, as it says, every 6 months. Now, you need to have at least one individual on staff at all times who is CPR certified and knows how to use an AED. And this is one area where we see a lot of problems and issues arise. And again, we talked a lot about legal issues previously. This is an item that needs to be covered from every fitness center that they are insuring and that they're doing. As far as fitness centers that are unstaffed, we should still make sure that there is an AED located very visibly. You've seen your AEDs, I'm sure, within most commercial buildings such as Georgia State University, for example, and other areas where many people would congregate. And hopefully, again, if it ever came down to it where someone needed an AED and you were around, you would be a first responder and know how to appropriately use it. And we've talked about PAD programs, public access defibrillation, and this way people know that if something happens in an emergency, as you can see here, that from the time of collapse to defibrillation would be hopefully as soon as possible. It says in 4 minutes or less. You recall the video example that we did that was pretty close to Atlanta, Georgia. I believe it was in Loganville, of the young 17-year-old volleyball player at high school who had suffered a heart attack and basically needed to be defibrillated and revived. And thankfully, there was someone on hand who was able to respond pretty quickly. And so, again, the best way to ensure that you are proficient in this would be to practice, do mock sessions, and just continue to put yourself in that role so you understand how it works and you can be confident with it. Why are waivers, liability, and assumption of risk so important? This gets back to our department manual again. Whenever ensuring that you're going to be looking over and overseeing the safety of your members and guests, we need to know who is using the equipment and who is in the facility and what risk factors they have. Again, we've covered this extensively with the different situational assignments where somebody who doesn't want to sign a liability waiver, what do you do then? Someone who has high risks, that they've had 2 heart attacks recently, high blood pressure, and that their doctors have even advised that they only work out under medically supervision during their exercise programs. How do you handle that? And these are different guidelines that need to be in place. And I guarantee that most fitness centers will have to have some form of documentation to where they ensure they go over the items such as the health history questionnaire, health risk appraisal, physical activity readiness questionnaire. These are all the forms that we've seen. And if you look in the back of your chapter textbook in the appendices, which, by the way, we'll cover pretty soon, they'll have copies of all of these forms so that way you don't have to reinvent the wheel. For example, for the entrepreneurs out there and the ones who are going out into business on their own, I would strongly advise to use a resource such as our textbook, and that way you can have the documents to use as blank templates, and that, again, to ensure that you can change up the template however you want and put your logo on it, but you can utilize those because they're standard both across federal and statewide guidelines. Now, obviously, by state, there may be different rules and regulations, but at least this covers you. And when we talked about legal issues, my philosophy is that this is one of those case scenarios that, less is not more, but rather more is more, where for yourself, you want to be covered as much as possible. You want to have as many obstacle barriers before someone can come legally after you. So that's why I strongly advise, for example, when you're beginning an exercise program, especially with someone you don't know or someone you just met, I would advise doing all of the above: the PAR-Q form, the HHQ form, the HRA form, having them make sure that they sign a waiver of liability with you, put that hard copy away so you have the original file, and give them a copy as well. And this just basically covers all of your ducks in a row, just so you know exactly who you're providing an exercise prescription for, who's using your facilities. And again, it ensures the safety of that individual. And that is the way to present it. The old cliche of how a commercial fitness center has somebody sign up, and when the member asks, so what am I signing here? And the staff says, oh, this is so you can't sue us if you die or hurt yourself, what have you. Well, again, there's a great better way to do it, and that's basically to give them the truth and tell them this is to ensure your safety and to allow us to know everything about you so that we can help you and we can serve you to the best of our capabilities. And that's what it really comes down to. Now, again, a lot of these are really long. I'm not going to read them word for word, but anybody that's using your fitness center, and especially as you go down in the middle of this, who is over the age of 50 or has coronary risk factors, diabetes, clinical obesity, the medical clearance form is so important, and that should be a mandate on all levels. So when someone's coming in and they are at a high risk and they've checked off, let's say, yes to any one of those PAR-Q questions on the questionnaire, you want to require a medical clearance. And This is not one of those, well, I could look the other way and just, they should be okay. I don't think they're going to have a problem, because this is where it opens up to huge litigation, liability, potential problems and such. So please make sure to cover yourself. And this is where, again, if someone has to fill out a medical clearance form, try to make it as easy and convenient as possible on their end. So in other words, in the old days, usually we would take a form on a medical clearance and give it to the member and say, yeah, go ahead and sign this, provide your date of birth, and make sure you fax this in so that they can fax it to us. Well, that's a lot of steps there, and what I would strongly advise, especially with today, everything's so streamlined and available online, you be in charge and you facilitate that form. Here's what I mean by that. When somebody comes into your gym and you find out, oh gosh, we need a medical clearance form from them, for example, you would have them give, consent and acknowledgement by providing you both the PAR-Q form that they've checked yes off to, and also the medical clearance form itself, where you would have them fill that information out and sign it, releasing authorization that you are allowed to get consent from their doctor, and make it as easy as possible. Tell them that you're going to send the information in, and if they don't have the doctor's phone number, if they say, well, I see Dr. So-and-so at Piedmont Hospital, but I don't know what their phone number or their email is. The great thing about today with Google and everything else, you can find that within 2 seconds by typing that in, and Google will give you the answer to that as soon as possible. They'll give you their fax, their email. Nowadays, not so much more fax, but nowadays you could probably scan that form, just email it directly to the nurse or the doctor's department, and they could be able to get that right back. And that way you can, hopefully begin that program right then and there. And in terms of the supervision and monitoring for the physical activity areas, this is very important. We've talked about a supervisor on duty, manager on duty, who is supervising, who's working out. No different than, for example, let's take your basic swimming pool. If you have a number of individuals in that pool, well, usually you would dedicate one lifeguard per so many heads of whoever's using the swimming pool at the time. So the same difference. If somebody and you have a number of individuals on treadmills and ellipticals and working out in the weight room, we need to make sure that we ensure the number of staff that should be overseeing it and monitoring to make sure that you have everybody working out safely and in a manner where they're not going to hurt themselves. And again, some of the other items that fitness centers can have. This all goes back to the department manual when you're completing the section of emergency plans. All of these items right here that it says on the slide would be great to have throughout your facility in terms of, especially in the cardiovascular aerobic training room. These charts, a lot of which, by the way, are free. A lot of these are provided by companies that for a benefit of you using their poster or displaying their information on the wall, so long as they can put their website or their logo or their name on it, will provide these to you no charge at all. And so you can usually get plenty of really nice looking posters and material from whatever resource you're going to get these from and utilize them. And again, any of these items that we're talking about just gives the members and the guests insurance that they feel like you care for them, but that you have their health and fitness in their best interest, which we do, obviously. Otherwise, we wouldn't be in this profession, or we wouldn't be working there. So this is important in terms of the facilities having competent, credentialed individuals working for their gym or fitness center, or whatever we're talking about here, that they provide things such as, we have every 6 months a CPR, first aid, AED training available so that we could certify our staff. And most of the either community or commercial gyms may offer to pay for either the whole entire amount or subsidize some of this, which we're not talking a lot of money. We're probably talking about anywhere between $50 to $75 to renew certification for every 2 years through any of, again, the accredited, such as Red Cross or the American Heart Association or any of the others that are there. But that's important that they're going to be having their staff certified. And obviously, incident reports, very important. when we get into next time we talk about scope of responsibility or scope of practice, this is important, again, for documenting everything that happened in terms of anything that you could think of incident-wise within the facility. So we've discussed what should go on an incident report. And again, another example of not less is more, more is more. Be as fully thorough and detailed as possible. Whenever, say, you're writing an incident report out, just imagine that a second grader is going to be reading your incident report. In other words, what I mean by that is to be as fully detailed as possible and to write it as easy for anyone to understand and comprehend your method of writing. So that just way that you cross all of your T's, dot your I's, and again, whoever's reading your incident report, it can be, again, very easy to follow and understand. So that covers risk management and emergency policies, again, pretty quickly. I don't foresee us having any issues on this PowerPoint or not because a lot of that was probably a refresher. So just, again, the summary and the final thing I have to say on this is just to please, if you are CPR, AED, first aid certified, continue on. If you have not had the opportunity or still need to get certified, please do it now. Just remember that there are different certifying embodiments online available, some of which are free. Now, I don't advise that to just say, well, I'm going to get this for free and this will be on my resume. That'll be great. You can do it, but we do need one of the ones that are, count as being legitimate. And usually those ones, you'll actually have somebody physically watching you perform the compressions and the breathing and any of the other things. It's almost like a mock role play, and those are going to be your best ones. And usually those ones you do have to pay for, but some of them are as affordable as I think my last one, in fact, this year was $40, and that covers me for 2 years with the American Heart Association. So if you need help on that, we have great resources, even here at Georgia State. In terms of getting it as affordable as possible, let me know, reach out to me, and I'll make sure that I get you that information. But it's great to network. That's where it comes into the power of knowing people and figuring out who does these certifications. So continue to have them, because if you're on this fitness and health journey, which most of you are, you're going to need that certification as a bare minimum requirement, and continue to just think of it as continuing education credits, that whatever else you're going to go along with your new journey. Okay, well, that covers it. I'll stop there. And again, let's continue on, and just let me know if you have any questions. We'll see you on the next lesson plan, everybody.